Hello, welcome to The Ordinary Doctor. I'm the Ordinary Doctor, Dr. Manan Mehta, with the topper, the all-rounder, my very dear friend, Dr. Varun Agarwal. Dr. Varun Agarwal is a urologist and a uro-oncologist. Varun, tell us something about yourself. Where can we consult you if we want to meet you?
Thanks, Manan, for the kind introduction. Let me introduce myself. I'm Dr. Varun Agarwal. I'm a urologist, uro-oncologist, and a robotic surgeon. Practicing currently in Navi Mumbai. I've got a nursing home, Agarwal Nursing Home, Vashi, Sector 17. And I'm attached to corporate hospitals, that is Kokilaban Hospital, Koperkerne, and MGM Hospital, Vashi.
Fantastic.
So,
So
yeah.
आज हमने आपको इसलिए बुलाया because we want to know everything about kidney stones. So before we start with the first question also, does
Yeah.
drinking beer help remove the kidney stone?
See, kidney stones normally they say that when there are small stones, it's easy to flush them out of the body. Smaller stones only. So drinking lots of water usually flushes them out. And beer, frankly, produces more water, right? So beer is like a diuretic. So once you have beer or any form of alcohol, frankly, it flushes out the stone by forming more urine. So I would not prescribe beer. Beer will never be a part of my prescription, definitely. But I would say yes, it forms more urine, so there are more chances of stone flushing out. So that doesn't mean a kidney stone patient should have beer for his stone to pass off. He can also have more water for his stone to pass off. So beer is not a treatment, definitely.
What exactly is a kidney stone? Exactly kidney stone होता क्या है?
तो कैसा होता है कि हमारे किडनी में नॉर्मली किडनी के अंदर सिर्फ यूरिन ही आना चाहिए, बनना चाहिए और जाना चाहिए. जब यूरिन में कुछ कुछ पार्टिकल्स होते हैं, कुछ वो धीरे धीरे सेडिमेंट होते हैं, व्हेन दे गेट प्रेसिपिटेटेड, so that ultimately over a period of time precipitate and they form kidney stones. So ऐसे basically solid particles अगर बन गए, and over a period of time when multiple solid particles come and they precipitate, they form stones. Now why do these solid particles come? There can be multiple reasons, like infection hua, yeah, calcium levels or phosphate levels in the body. These levels, there is a disturbance in these levels, so particles come in the urine and they sediment and they form stones. If you want to know more about stones, there are 3 4 types of stones. They can be oxalate stones, uric
Hmm.
acid stones,
Hmm.
phosphate stones, cysteine stones. So commonest is oxalate. Almost 98-99% patients have oxalate stones only. Yeah.
और इसमें कोई ऐसा रहता है कि somebody has more chance of getting a stone compared to the others?
So what exactly happens is that water consumption is actually very vital, to prevent stone formation. So those who are in warmer climates, like climate of India is really suitable for stone formation, I would say. So that is because of mainly the climate and less water consumption. We usually don't realize a lot of water gets evaporated from our skin also. Even while we're breathing, we exhale out water in the form of water vapor. These are the two main factors for stone formation. Apart from that, there are dietary factors also, but they don't play that much of a role as much as less water consumption and climate does.
Yeah, इसीलिए ना. So India has many stone belts. That is why 3 of my best friends are neurosurgeons. So hence proven. So
Yeah, that's why there's a lot of demand for neurologists. Yeah.
so is there any good prevention? I think you already explained that कि पानी ज़्यादा पियो and balance रखो. Is there anything else apart from that would you advise as a prevention?
Yeah, so water, obviously, first and foremost. Secondly, there are some diets that you can definitely try. I mean, like they say that salt restriction has to be there. To some extent, you can avoid caffeine, and animal red meat, that is that is pork, chicken, poultry, fish. All these factors are said to have relation to increased stone formation. Have more consumption of fruits. अगर हम fruits and vegetables ले तो काफी फायदा रहता है. लो ऑक्सिलेट हेल्प्स, लाइक ऑक्सिलेट अगर ज्यादा लिया तो स्टोन फॉर्मेशन होता है. लो
Hmm.
ऑक्सिलेट डाइट हेल्प्स. So now what is a low oxalate diet? You can have eggs, rice, apple, cauliflower, grapes. All these are low oxalate diet. These are good. However, high oxalate is dark chocolate, black
Hmm.
tea, soybean, all these things, spinach, potato. These are high oxalate diet. So
Okay.
these you can avoid. Calcium rich diet should be there. So, curd, buttermilk, yogurt, all these things can help. So it's not that, if you have too much of calcium, then there'll be stone formation. You need to have an adequate amount of calcium in your diet as well. So and one thing is that many people are into cold drinks and all these things. Yeah, these cola drinks, they have a lot of phosphate, and phosphate really causes stone formation. Ultimate thing is water. Frankly, have a lots of water. It prevents stone formation.
Okay, so because you said about calcium, तो मैं calcium का भी पूछना चाहता हूँ. There is always a controversy कि मुझे stone हुआ था, तो अब मुझे arthritis भी है, तो मुझे calcium लेना चाहिए नहीं लेना चाहिए. What is your opinion on that?
ये अल्सरेटेड, बहुत कम कैल्शियम लेने से भी स्टोन होता है, बहुत ज्यादा कैल्शियम लेने से भी स्टोन होता है. यू नीड
Okay.
टू हैव कैल्शियम इन द बॉडी. अगर बहुत कम लिया आपने, तो जो ऑक्सीडेट होता है बॉडी में, वो प्रेसिपिटेट होकर स्टोन बन जाता है किसी और के साथ. तो कैल्शियम लेवल ऑप्टिमम होना चाहिए बॉडी में. बहुत ज्यादा लेने से भी प्रॉब्लम होती है. तो जो कैल्शियम सप्लीमेंट जो लेते हैं, उसमें कोई ऐसा प्रॉब्लम नहीं है. वो वही लोग लेते हैं जिनका कैल्शियम ऑलरेडी कम होता है बॉडी में, उनके लिए होता है वो. So you can definitely have calcium supplements, calcium tablets में कोई प्रॉब्लम नहीं है. Definitely you can go for it, but ऐसा नहीं है कि बहुत कम, या मैं कैल्शियम लूंगा ही नहीं. नहीं लेने से भी स्टोन होता है.
Stone
So
होता है. Correct.
you should have an optimum level of calcium in your blood.
एंड मैनी अ टाइम्स वी गेट द क्वेश्चन कि वो सीड्स वाले फ्रूट खाएंगे, वो दाने वाले फ्रूट्स खाएंगे, वो सीड्स इंजेस्ट करेंगे, ये जैसे भिंडी के सीड्स है या सीड्स वाले फ्रूट
नहीं
खाएंगे तो
नहीं
किडनी स्टोन
नहीं,
के चांस बढ़ जाता है, ऐसा कुछ.
बिल्कुल नहीं 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 नहीं, ऐसा
सो
नहीं
इट्स
है, ऐसा नहीं है.
the oxalate fluid and calcium content which matters, or if it's
Yeah, that
equivalent
is
for
what
it.
you know.
Okay.
Exactly. Yeah.
So suppose patient आते हैं, obviously symptoms सबको पता है, पेन होता है and urine में there is a lot of problems and it's a very typical pain जो हमने सबने देखा है. What are
Yeah.
the levels of investigation जो आप advise करेंगे for the stone? Is it only sonography or there are other things also?
पेन अगर एब्डोमेन में है, तो फर्स्ट थिंग एनी डॉक्टर वुड डू इज सोनोग्राफी. सोनोग्राफी तो करनी ही होती है. अगर सोनोग्राफी करेंगे, उसमें हम साइज ऑफ स्टोन देखते हैं. अगर सिग्निफिकेंटली थोड़ा ज्यादा लग रहा है, सो देन वी इन्वेस्टिगेट फर्दर. इफ वी फील द स्टोन इज स्मॉल, 3-4 mm, छोटे छोटे 5 mm स्टोन्स है, तो नथिंग हैज टू बी डन फॉर इट, और आगे हम इन्वेस्टिगेट नहीं करते हैं. But yeah, if it's a bigger stone, and which deserves some sort of surgical intervention, then we have to do a CT scan, further investigate. Some patients में CT scan नहीं कर सकते, तो other investigate IVP करके होता है, वो
Hmm.
करते हैं.
Okay.
X-ray can be done in follow-up once a stone surgery has been done. If in future also patient has some pain or something, so we just to see if there is any residual or small stone left after a surgery, we can just do a simple plain X-ray. That is when an
Hmm.
X-ray is handy. Otherwise, if you're planning a surgery, frankly, X-ray is not of much use in today's world when we have such good and better investigations like CT scan.
So, I mean, obviously, you said कि अगर कुछ medicines हैं, which we won't get into, which are the specific medicines, जिससे we can help the kidney flush the stone out. But tell us more about the surgery. अगर आप explain कर सकते हैं कि what is the ESWL, DJ stenting क्या होता है? Just explain a little about the surgery techniques to us, please.
So depends on where the stone is. Now, when stone को तोड़ना, the procedure of stone को तोड़ना बोलते हैं lithotripsy. Stone जहाँ भी है, अगर उसको तोड़ने को lithotripsy बोलते हैं. So if it is in the bladder, उसको
Hmm.
stone, वहाँ का stone तोड़ने को बोलते हैं cystolithotripsy. Cysto means bladder. So
Hmm.
cystolithotripsy.
Hmm.
So if it's in the ureter, ureteroscopic lithotripsy. And if it's in the kidney, उसको बोलते हैं percutaneous nephrolithotripsy. So basically stone हम लोग we break it with the help of a scope, और जिसको हिंदी में बोलते हैं दूरबीन in layman's term. दूरबीन से जाते हैं, लेजर से हम फोड़ते हैं without any incision on the body. These are the 3 surgical techniques if I have to speak about them. इन नॉन सर्जिकल टेक्निक होता है एक ESWL, जिसमें स्टोन यूजुअली किडनी में होता है, बहुत छोटा होता है, और पेशेंट्स जो फिट फॉर सर्जरी नहीं हो पाते, उनको ये ESWL ऑप्ट करते हैं. इट इज अ नॉन सर्जिकल टेक्निक. उसमें हम पेशेंट को एक मशीन में लेटाते हैं. इट्स जस्ट लाइक अ CT स्कैन मशीन. सिमिलरली वी मेक द पेशेंट सिट इन, लाई डाउन इन अ मशीन, एंड उसमें अपने आप स्टोन को ब्रेक करने के लिए वेव्स निकलती है उसमें से. So it's called ESWL, extracorporeal shock wave lithotripsy. Now it is slightly getting outdated because we have such very good surgical techniques available to clear the stone, because it is, and ESWL is getting outdated slowly because the stone clearance rate also sometimes is not that great with it. You asked me about DJ stenting. So DJ stent basically is a pipe, is a tube, is a stent which comes from the kidney to the bladder. Why is it put is to bypass the stone. Like if there is a stone anywhere in the urinary tract, and if it is obstructing the flow of urine, we just put a stent, a DJ stent, which will bypass the stone and continue the urine formation, and it will continue the flow of urine from the kidney to the bladder.
सर्जरी के कितने दिन बाद ये स्टेंट रिमूव होता है इन जनरल?
तो इट डिपेंड्स ऑन द सर्जन। बहुत सर्जन सर्जरी के बाद स्टेंट नहीं भी डालते हैं। अब जब डालते हैं तो कोई 2 वीक्स होता है, कभी 3 वीक्स होता है। इट डिपेंड्स ऑन द टाइप ऑफ सर्जरी की यूरेट्रिक स्टोन था कि किडनी स्टोन था, उस पर भी डिपेंड करता है। और सर्जन को पता है कि अंदर कितना है, क्या है, स्टोन की वजह से कितना अंदर किडनी को डैमेज हुआ है, कितना हार्म हुआ है। सो टू हील दैट whatever damage has occurred because of the stone, we keep a stent for a prolonged period of time also sometimes. Sometimes we just remove in 2 weeks. So it depends on patient to patient. You can't have it like it's not fixed कि 2 weeks में ही होगा, 3 weeks में ही होगा।
Right.
ऐसा है।
And इसमें could you just tell us, I know it's a difficult question, but recurrence के chance कितने होते हैं?
Yeah, I am sure you must have heard this once, a stone former is always a stone former. So तो अनफॉर्चुनेटली रिकरेंस के चांसेस हाई होते हैं। आई कांट गिव अ परसेंटेज, देयर इज नो परसेंटेज, इट डिपेंड्स फ्रॉम पर्सन टू पर्सन फ्रैंकली। बट या एक बार स्टोन हुआ तो स्टोन होने के चांसेस होते हैं। सो आई नॉर्मली एडवाइज माय पेशेंट्स कि आप 6 months to 1 year में एक बार सोनोग्राफी करके चेक कीजिए कि स्टोन वापस बन रहा है कि नहीं बन रहा है। और जो भी मैंने डाइटरी मेथड्स बताए आपको, वो आप यूज कीजिए टू प्रिवेंट स्टोन फॉर्मेशन एंड हैव लॉट्स ऑफ वाटर। So otherwise, stone formation के chances, recurrence के like you asked me, are quite high. They can occur, yeah, again.
Right. So this has been great. Thank you so much, Varun, and very nice and lucid and short explanation. So I hope we can have you back soon to talk about the robotic surgery part, which I think काफी fascinating है, and very few people in the country, in the world are doing that.
Absolutely. Thank you so much, Manan, for having me here on Mehtabolics. I mean, I'm glad that we are doing this and spreading awareness, and it's actually quite needed. The questions that you asked were like really basic questions, and patients always ask me these questions. So, you have actually made it quite patient friendly. So, I'm glad you did that, and I'll be really happy to appear once more, maybe on your next season. And talking about seasons, we can next time maybe we can upgrade it, rather than a Zoom meeting we can have a face-to-face meeting, and like we can also name it like coffee with Manan rather than something else. So I hope we upgrade it and we do another topic soon. Thank
All
you
right,
so much,
buddy.
Manan, for having me.
Take care.